carries on. So yeah, we should be ready to go.
Okay, let's go ahead and I'm going to go ahead and put us on Facebook Live, okay? So here we go. Okay, it's a little too complicated for me to sign in, so I'm going to go ahead and get started. Good evening, everyone. My name is Delegate Mark Freeland. I represent 8 chapters out of Eastern Navajo, Crown Point, Nahadishkish, Tseheahe, Vicente, White Rock, Lake Valley, Herfino, and Naizi. The 8 chapters that I represent fall within 2 service units, Crown Point Service Unit and Shiprock, or the Zitlan Deathly Clinic. I want to thank our IHS partners for being on this broadcast this evening. I wanted to utilize this time to relay a message and have our medical experts give us an indication as far as what we are facing at this time. You probably have all heard that we are really at a capacity of the service units and around the nation. So I wanted to have our experts give an indication as far as what we are facing. What do we need to do going forward, and how can we prevent these uncontrollable spreads? Yesterday there was a press release that went out that had identified 77 communities in the nation having uncontrollable spread. So what do we need to do? We all have a individual responsibility. What do we need to do to help decrease those numbers? And we just got another press release from the president's office saying another 173 positive cases identified today of COVID-19. The focus is on COVID-19. I appreciate all of our experts being on the line, but I just wanted to say that, and thank you for joining us this evening. Real quickly, Melinda, can you give us a quick prayer? Melinda, are you able to provide us with the invocation?
Hi, can you hear me?
Yes, please. Thank you.
Okay, thank you. I'm sorry. Thank you for asking me to do the invocation this evening here in Chicago. I really appreciate it. It's always an honor, as they say. In my family, that's a part of a big teaching for us, is anytime anybody asks you to pray, it's always a very big sign of respect. And so I just wanted to definitely offer some good words this evening as we proceed into the meeting that we have here. Akoshi ya dadinich Kudohojodo leishman hastan yadilkitli hitrati in the Nothaningi Hasjewan Ashjayalki Zifistan Twistan di Kodoea Dij Ilkaningi Hutawe Trizin Liningi Behanana Sidolech Di o Ahligi Biyitjido Ben Nachet Eya Nsaha Kesto Hashin Sojet Eya Di Kodo Eya Nehe Azel in Dan Liningi Big Edano Idolech Biltahano Lodolech Adonana eya first line workers dan linigi do ad di kodo e non nishigi ai si bitsket adad enigi hut au e yi indal de do ahui jishi eya hut au di koyan sada keso e nike e do nike danaba do ben nacho ben ya eya di kodo non nishin linigi ke nana Ako e hut au e big edan I do leil do bada lian do leil bedo e bilhaji dan linigi bamado da baja shi da holon do bitche do bed da benale do has twizani dan linigi hut au e din kon bahasti do leil do a shil do hut au e bansis keso e ananat e do leil ado nana di ko anal sos dan dehigi do big eda sohigi e hajoshi hut au e di kon be updates ada del nilto ada do nilto ko e hot au e di kodo Jonna slit do lilto e hot au shin ban nache ban sa de kc gi do ban nache in hinanish dat gi e a hunanat e do lilto ko e a hun soj e ya trizan linigi be hasti do lilto ni do lilto ko e a di da zil zil hat ada no linigi ni e ya a large e nat ani da no ko ni e ya ni kedo a chud á é si ban sa dé chéas a slot an lídó le le có é cha áte sis na gin se a áte so é áte dó go slí na han cos é de bensa áróid é dan so cenigi de lá de lídó deol é a chud á é dí chun hiic an ídó le a chud á é na is sin linigi é be cé na í cató le huijanna haslí huijanna haslí huijanna haslí huijanna haslí. Thank you.
Thank you, Melinda. And Tago, thank you for that blessing as well. And thank you. We'll go ahead and get started now. Tonight's focus is on COVID-19, uncontrollable spread. I wanted to welcome everyone this evening. Delegate Mark Freeland, I introduced myself already. I want to just go ahead and jump right into our presenters. I'm going to go ahead and turn it over to Rosalind. So Navajo Area IHS and your team. Go right ahead, Rosalind. And welcome, Dr. Jim.
Good afternoon, Delegate Freeland. Good afternoon, everyone that is on the line listening to us or watching us provide these updates. Thank you. I am Rosalind So. I'm the Area Director for the Navajo Area Indian Health Service. I have a number of presenters that are going to present, and we'll just sort of go down the list that we have. So to that, we're asking that our presenters from the Navajo Area IHS give about a 3 to 5 minute presentation. There's an enormous amount of information that we want to provide, but we also are mindful of giving too much and then losing our points in our conversation with you. The point is to give you as much information as possible, and also provide an opportunity for questions or some kind of feedback, so we can better make sure that we're improving our messaging to you. We are monitoring almost hourly now our hospital situation. We are very, very busy in our hospitals, and Dr. Christensen will describe that a little bit more in terms of just where we are as far as our hospital beds, our ICUs, our ability to transfer patients out, and those kinds of things. We're also doing a number of calls almost all day long these days with our partners, trying to secure additional PPE, additional staffing. I think this time around we're seeing some changes from what we experienced the first time around, and it's become a little bit overwhelming at times. But we are, I'm just surprised and amazed at how well our hospitals continue to manage, but that's coming at sort of a price for some of our staff. So Captain Brian Johnson will also talk about the staffing that we have requested and their status in terms of being on the ground for our staff. Specifically though, we have asked for mental health support for our hospital staff and all of our IHS staff throughout the Navajo area. So we have 10 mental health, public health officers that are on the ground right now, and they come at a very important time for us to help us deal with some of the issues that many of our staff, which are also members of the Navajo Nation, Navajo area, and that we're experiencing all of the challenges that everyone else is experiencing as well. We'll also give an update regarding our EPI and our contact tracing. Chanel Damon, who's doing an outstanding job for us for the Navajo area, has stood up the contact tracing program for the Navajo area, and we'll talk a little bit about that. And then we'll turn it over to talk specifically about Crown Point Service Unit. Pam is on the line, as well as Dr. Slaughter, who will give an update specifically regarding what's going on at Crown Point. And then we also want to make sure that we give an update on DZ as well. And Commander Waito is on. She's acting, as we reported before, that there's a change over there in leadership. And then finally, we'll close out with Marquise Yazzie, who's our tribal partnership director. And so he'll give an update on tribal activities as well. So again, thank you very much. We appreciate the opportunity to talk with you. I'll turn it right over to Dr. Christensen. Thank you.
Thank you, Dr. Christensen.
Yes, thank you, Honorable Friedman, for having us tonight and the opportunity to speak to everybody. So I want to briefly go over the status of our hospitals and our patient care at this time. We are extremely busy at all of our facilities, and we have reached capacity several days in the last month. However, we have been able to successfully still transfer our critical patients to tertiary centers in Albuquerque, Phoenix, Flagstaff, and Tucson. So that helps us quite a bit to decompress our intensive care unit, which we have expanded from 13 beds up to 18 to try to accommodate additional patients. Our floor beds are also getting very busy. We hit 82% today, which is the highest that has been since this second wave has started. Our ICU beds went down a little bit because I said we added additional beds to help us decompress. As you know, we are in shortage of nurses, and we've worked very hard to bring in additional staff to support our staff who have worked so hard throughout this whole pandemic. And we want to give them support and relief whenever we can. But they're still able to staff all the beds that we need, and we're extremely thankful to the resiliency and the extraordinary effort put in by our staff across Navajo. I feel that at this time, we are not fully in a crisis mode, but we have approached it a couple of times in the last week, and we are watching this very carefully so we know when to enact other crisis standards. We are still extremely busy, and as you will hear, the number of positive cases is extraordinarily high. This surge is much higher than the first, and therefore we are having to use additional resources and staffing to cope with the hospitalizations that we're experiencing. So I feel that at this time we are operating well, we are functioning, we're able to provide care to everyone who presents to one of our facilities. And one of the keys to that has been the ability to share resources between service units. Crown Point has stood out in this regard as they've helped Gallup taking patients to help them decrease their overall volume. And they've really done an excellent job assisting others during this pandemic. So we're very thankful to Crown Point Service Unit. I'm going to let Captain Johnson will tell you about the deployed teams, but we have been very fortunate that we are getting some additional help into Navajo area. Again, we're very grateful. So I'm just going to shift a little bit into some vaccine information. I do want to tell you that the vaccine information changes quite frequently, and we try to keep giving you the most updated information available to us. So as of today, this is what we are expecting. The Pfizer Ultra Freeze product that is being reviewed by the FDA and their safety team is going to be completely reviewed on the 10th, and we expect that they will get approval shortly after that. Once that happens, we are expecting a first shipment from Pfizer the week of the 14th, and we think that date will be the 17th. We don't have confirmation yet, but that is what we believe is going to happen. Because this particular vaccine requires very ultra freeze temperatures, -70 degrees, there is a special way this has to be handled. Therefore, it will be shipped directly to Chinle, Northern Navajo, and Gallup, as they all have ultra freeze capabilities. From there, our area EOC team will pick up portions of those vaccines to deliver them to the remaining federal and tribal sites throughout Navajo. So we have a distribution plan that will allow us to divide up the vaccine and drive it to the facilities across Navajo where everybody will have a share of the allotment that we are receiving. In regard to that, we had a meeting earlier today and we've been planning for some time on how the allocation of these vaccines will occur. And we are following the ACIP guidelines for the allocation of vaccines. We will be following that at this time. It does change and we will update every time it changes so that everyone has the most current information. So this is targeted to come out on the 17th. The second vaccine that will be presented the following week for approval is Moderna. They're very similar vaccines. They work very much the same way, and the side effects reported for both are very similar and fairly minor. There's been no major side effects from either vaccine. The Moderna is scheduled to arrive sometime around December 23rd. When that happens, those will be shipped directly to each facility because it does not require the extraordinary temperature that the Pfizer vaccine does. So we will be able to receive 8,000 doses from Moderna, and that will be sent directly to each federal and tribal hospital and healthcare clinic. So these are the updates on the vaccine that we're expecting. The first wave of vaccines, we will be vaccinating our healthcare frontline workers that have the most interaction with those patients that could be COVID positive. And we have lists developing at each service unit. So we have all of our patients ready to go. When the vaccines arrive, they will be notified, they will be told where to report, and they will receive the first dose of their vaccine. Both of these vaccines require 2 doses between 21 and 28 days. We will receive a second shipment before that due date for the second dose for both the Pfizer and the Moderna. So we will be getting the first dose in that week of December, and then in January, we will receive the second dose for both of those, and we will have already scheduled all of those people who received the vaccine to come back for their second dose. After that, we have a lot more flexibility about ordering vaccine, and we'll be able to put our orders in for one or both of those vaccines. We've worked very hard as a vaccine team under the HCOC branch, and it has included participation by all facilities at all times, and we are all very supportive of the process and of each other to make sure everybody gets all the equipment, vaccines, and supplies that they need. So that is the status of our vaccine as of today. So I will take questions later regarding either the hospitalization data or the COVID vaccine data. Thank you.
Rosalind, did you want to continue?
Yes, sir. If we can move on to Captain Brian Johnson.
Good evening, everyone. This is Captain Johnson. It's nice to be here with everyone on the call. Appreciate the opportunity to give some updates on what we're doing. I'll just make some comments here. You know, in these types of situations, and I'll parallel this with the first wave of the COVID here on Navajo Nation. We did reach out before, knowing that in some cases we have various staffing shortages in nursing and some of the other specialties, things such as laboratory technicians and laboratory scientists that work in our laboratories and our health facilities. We reach out typically not only through the federal resources, but also through various state resources. And then we also have individuals who work to identify volunteer organizations and who work with volunteer organizations throughout the year and attract some of the key individuals that we need to continue our operations to the highest standard possible. And in particular, whenever we have an opportunity, since we are a federal program, we do have an opportunity to reach out to the U.S. Public Health Service. And some of you on the phone may or may not be familiar. If you see individuals in uniform, PHS uniforms, those are public health service officers that are permanently assigned here on the Navajo Nation. And then we have sister agencies that also hire PHS commissioned officers and are oftentimes able to allow them to deploy in our time of need, just like we deploy during times when there's hurricanes and other national emergencies located offsite elsewhere. And so during the first wave we did, and we were successful in bringing in, working with the Department of Health and Human Services at the national level, also working with the states of Arizona and New Mexico, and working with the Public Health Service in bringing those resources in. In the second wave, it's a little bit more challenging in terms of the number of staff that are, or officers that are readily available across the United States. As was mentioned, when we look across the United States and the COVID-19 situation at this juncture, we do see that there are needs throughout the United States, and certainly Navajo is one that we have made sure that information orders, and working with also with FEMA and other agencies in the department to make sure we identify resources that we can. So most recently, as was alluded to just a bit earlier, one of the things that we've always tried to focus on is our staff members, and we hear a lot about frontline staff and what they're facing and dealing with, not only here on Navajo Nation, but across the country and all healthcare organizations. And we made an effort from the Navajo area level to really make sure we're thinking about how our staff members are feeling, how they are doing. It's a really a challenging time for them, on the folks on the front lines. And so we do want to take care of them. In terms of mental health support, we were successful in working with the U.S. Public Health Service and bringing in 10 behavioral health services providers. And just as an example, at Crown Point, there will be 2 located on site, and they just recently arrived. And we also have 8 others at the various service units, federal service units around Navajo Nation. And so the purpose of these individuals are to, give an outlet for our providers, our ancillary staff, individuals who work in the hospital. As we know, a lot of individuals have been impacted either directly or through their extended family members. And it's just an opportunity to be able to talk with someone and make sure that we're checking in on our employees. So we're thankful for those officers being here on site. And these individuals who deployed with behavioral health services will be here a minimum of 30 days. And then we'll see if we need to extend that, and we'll move forward with that if needed. The next group of individuals that officers that we've been able to bring in are actually part of what we refer to as the National Disaster Management System, NDMS, or also known as DMAT, and it's the Disaster Medical Assistance Teams. And these also are officers who are federal employees who are a part of the NDMS and DMAT teams. And we just recently, again, and over the course of the last couple of days, have seen the arrival of a couple of teams at this point. One team is specific to Crown Point, and it's a total of 8 individuals, which is primarily lab scientists / technologists that are coming in, and also nurses. And those are, of course, some of the more important positions in the hospital setting. So we're really happy that, specifically in this case, we were able to get 4 ED nurses and then 2 med-surg nurses. I'm going to make a slight correction here. 4 ED nurses and 2 med-surg nurses for a total of 6 nurses. And then we were also able to attract some laboratory scientific scientists and technologists. And in fact, those were just arriving this evening. So we're happy about that. And I was just on the phone with their team lead just prior to this call. So that'll provide some much needed support. What we find in our rural areas, in our rural hospital environments, is whenever you have a situation, for example, with laboratory scientists, it's very important to have a number to be able to provide the services needed when we're increasing testing, when we're increasing all of our services. And those individuals need support, just like the ED nurses or emergency department nurses need that as well. So again, we're happy to say that we were able to tap into those resources at a federal level, and glad that they're going to be here on site. Some have arrived or are working with them. Also, when we look around the area, for example, just to kind of give a little bit more of a broad perspective, Gallup Indian Medical Center is also receiving some of those resources. And specifically, when I mentioned the NDMS and the DMAT, again, the National Disaster Management System and the Disaster Medical Assistance Teams, 17 of those individuals have recently landed in Gallup and are providing services there, which, as many of us know on the phone, can help support what's going on at Crown Point as well. If Crown Point needs to send patients over to GIMC, then they will definitely be supported by those individuals. And vice versa, if GIMC needs to send patients over to Crown Point, then again, those new staffing resources that are there to assist. Similarly, we've attracted some of the same individuals from the same sources for Shiprock. And so we're happy about that. And then on a final note, one of the things we're working on right now is working with the Department of Defense on sending additional nursing staff to Shiprock, as well as to Chinle, and it looks like that's presently developing. And we hope to have individuals from the Department of Defense. This would be nursing resources, whether that be ICU or emergency department or regular RNs. Those will be coming, so we're excited to hear about that as well. Now, this just kind of gives, I'm just trying to express that this is a lot of activity to pull individuals and officers from different parts of the country, and to bring them to Navajo, and knowing that there's competition all over the United States for these resources. And then I'll just add that we also, through Dr. Christensen and her staff, have a very robust program to help attract volunteers, organizations. We talk about NGOs. These are non-governmental organizations. So private organizations that are oftentimes nonprofit. They also help us whenever we can reach out and attract volunteers to assist, and that can be providers, that are doctors, that can be nursing staff, various types of volunteer staff that we need. And so those other resources continue to be pursued, separate from the federal resources that I was talking about as well. And we definitely, when we're talking about something like COVID-19 and the just the extent and the time frame that this has been going, staff need a break, and they need rest. And so it's very, very critical that we continue to pull in the federal resources, state resources when possible, as well as the volunteer organization volunteers, and we'll continue to do that. So with that said, that just provides kind of an overview of what we've been busy doing, and we will continue down that path. So with that said, I'll turn it back to Delegate Freeland, possibly for the next speaker.
Thank you, Captain Johnson. I'll go ahead and defer back to Rosalind and your team. Thank you. This just for the listeners, I want to also welcome Representative Teller. Thank you for joining us, brother. Hope you're doing well. For all the listeners out there, this is really a town hall for related to COVID-19. We invited the Navajo Area Indian Health Service as well as the Navajo Department of Health. As you all are well aware, we have a high rate of COVID positive cases on the nation, and you're probably seen it on the radio or in the news media. So this is just an indication as to what we are facing right now on the Navajo Nation. So I'll turn it back over to Rosalind. Thank you, Rosalind.
Thank you, Delegate Freeland. So let's keep moving. Let's move down to the epi data and the contact tracing. Chanel, can you please proceed with your update?
Hi, good afternoon and good evening, everyone. Yat A Shaya Chanel Damon Yanshia, Ashiya Yanshla, Belagana Bashish Chin, Torchini Dashache, Belagana Dashanala, Nija Sana Adena Shah. Good afternoon and good evening, everyone. Yes, so I've been on the Unified Command Public Health Co-Lead, and I have been working very well with our teams who help assemble a lot of mitigation that is going on with COVID-19. So the teams that have been established within our Unified Command, we work closely together with the Navajo Nation Epicenter, the Navajo Nation, Johns Hopkins, and a lot of other partnerships throughout the reservation, especially COPE and Partners in Health. So we have teams that have set up case management, community mitigation, public health messaging, and epidemiology. And so through those teams, we were able to share numbers. And right now, we had just received the SIT report from the Navajo Nation Epicenter. And daily, we at Navajo Area IHS, Dr. Kettering, we clean the data, and then we send it over to the Navajo Nation Epicenter. And then they get all the data from the 638 facilities. And then we're able to come up with a daily SIT report that the Navajo Epicenter puts out daily. So today we had 18,324 cases and 159 new cases just up to date. And then we have 688 deaths. And so those numbers all come together with our teams. Also for our case management, that team is led by Dr. Moses and then Sherry from the Navajo Nation Epicenter. And in that team, our teams have established contact tracers. So we have about 300 to 350 contact tracers throughout the whole Navajo Nation to respond. Usually you want 5 contact tracers for every 1 new case. So we definitely are trying to increase our contact tracers across Navajo Nation. And this is a very good way to mitigate also with the lockdowns, to mitigate the spread of COVID-19. We do backward contact tracing and forward contact tracing, which we're allowed, and that allows us to see where the person has been before they got COVID and then after, where they've been now since then. And then we're able to follow our COVID-19 patients from diagnosis to recovery. And from that, we can see like if they need to go back to the hospital, or if they have needs that they might need at home, where it be like sanitation or home hygiene equipment or food. So our contact tracers work very well with our team in case management, with the Navajo Nation Epicenter, and with COPE. So those are some of the things that we're doing to mitigate the spread of COVID-19. We also have a public health messaging team that puts out messaging that is appropriate, and it doesn't change, but we're always updating weekly, because we're noticing that most of our COVID-19 cases are coming from gatherings. So gatherings meaning, coming over to dinner, visiting with friends from different households. So for me being home right now, then I would get a visitor, and so we're putting out messaging how to gather safely, to keep that person 6 feet away from you, to wear a mask, to have maybe the door open if the weather is not too cold, which it is now. So those are some of the things that we're educating people on. And then our community mitigation, they have a school health team there, and then we also have a public health, mental health team. And those teams are coming up with solutions or plans to help, at home. We have a lot of kids at home right now who are not in school, who don't usually get maybe that one safe place that they might have had for 8 hours. We also have, a lot of health disparities that affect our people. So we want to make sure that we're putting out, and having access to, mental health wellness, exercises and self-care. We also want to make sure that we're sending out information on how to respond correctly to a crisis. And so we have mental health first aid, QRP, or QPR, and those are some of the things that we're trying to get more and more in the community. And at the same time, in the Navajo area, we're hiring behavioral health professionals. So if you know anybody who would like to have that job, we definitely have that one open. And then also, I just want to touch base again, our epidemiology response team. They all work together, again, from all our service units to respond to clusters, critical notifications, and to make sure that we are testing more, and then at the same time, continuously monitoring the cluster. So those are the things that we do with the public health branch of the Unified Command. I want to thank all my team members, all the way from all the service units, all around, and the 638s, and then at the same time, our partners. And so I am just a small picture and, getting all of this together. So I definitely want to say thank you to all the team members. And if you have questions when it comes to the numbers, we can go over that. But that's how how the daily SIT report is aggregated at the Navajo Nation Epicenter. And so everything's done in teamwork and unison. Thank you.
Thank you, Chanel. This is again is Rosalind, so the IHS Area Director. The presenters that just presented are trying to give the entire Navajo area perspective on everything that we are trying to manage and coordinate. Now I want to move down to the Crown Point Service Unit and see if Pam is on the line, as well as Dr. Slaughter. Commander Smiley can give an update for her service unit, and then we'll move right into DZ and have Commander Wade also give an update. So Pam?
Good evening. Can you hear me?
Yes.
Okay, great. Thank you, Honorable Freeland. I appreciate you having Dr. Slaughter and I representing Crown Point Service Unit on the call. I am the acting CEO at Crown Point Service Unit, and I'd just like to reiterate what Captain Johnson and Dr. C had discussed for Crown Point Service Unit. We did receive 2 teams this week. We are receiving another team tomorrow. which we're in dire need of. It really addresses our staffing needs. We have a dire need of nurses in the emergency department as well as inpatient. We also have a dire need in the laboratory department. So I'm very pleased and thankful that we have these teams coming to the nation supporting us, as well as our area leadership, Ms. So, Captain Johnson, Dr. C. They have heard our needs here in Crown Point, and they're very supportive, so I appreciate that. Right now, currently, we are working on our vaccination distribution plan. And I'm going to have Dr. Slaughter discuss a little bit about that. And overall testing. We continue to test at Crown Point Service Unit and at the satellite clinics in Pueblo Pintado and Through Health Station. So we continue, and our EPI team has been tremendous in assisting and mitigating and contact tracing. It's tremendous work. It's tiring. This time around, this second wave has been really challenging for us at Crown Point because COVID has impacted our staff at Crown Point. So, so to have these teams support us, especially the behavioral health officers, I'm so grateful that they're here. So I'm going to have Dr. Slaughter speak on our services. Thank you, Dr. Slaughter.
Hello, and thank you for inviting me, and I apologize for my laptop with the camera going out on me this right before this started. I don't want to repeat too much of what anybody said, but the deployed teams for the lab and the nursing and the behavioral health are really going to let us rest our staff who've really done a heroic job working together, helping each other out, maybe in different departments. Maybe they're used to working in the clinic and they're helping in the ER or inpatient. It'll be a very nice holiday present to let our staff get a breather while we have the assistance. In the spring, I mean, the things that I think are different, in the spring, we had isolated hotspots. You know, it was Washington State, it's New York, New Jersey, and then to us. And it was easy to move nurses and respiratory therapists and ventilators and oxygen to where we needed them. Right now, the whole country is trying to surge at one time. I think we've all had enough of 2020. And so mask and social distancing are not what we want to do, but what we need to do. Just for the volume, in the spring, we peaked in Crown Point with 76 cases in 1 week in early May. For the last 3 weeks, we've had anywhere from 120 to 140 cases per week. And our positivity rate is running right around 22%. We are trying very, I do want to reassure everybody, we have no plans at this time to close Through or Pintado. We have several contingencies to keep those open because we know the pharmacy and just the clinics themselves are really needed for our remote chapters. We are doing our best to have enough staffing at all 3 facilities so people can walk in on demand, test, and get testing. Some days, depending on emergencies or whatever is happening, we might not be able to accommodate that, but we are trying our best. One thing our EPI team has found out is we don't always have good phone numbers. If you're going to get tested, please leave us a number where we can reach you. It's pretty frustrating for us and very frustrating for you to be waiting for a test and we can't get a hold of you. We've had some other questions about the difference between drive-up testing versus driving up to our ED and ambulance entrance and being evaluated. The drive-up testing lane is really more, it's not really a doctor's visit. It is like, I'm here, I'd like to get tested, and we send you on your way. If you're having cough or trouble breathing or lots of questions or symptoms. I mean, to get to have, we can't run 100 people through the testing line in a day by spending 15, 20 minutes with everybody. Those are the ones that if we are worried because we hear you coughing or your breathing looks labored, we are urging you to move from the drive-up test line to go and be evaluated, where nurses and providers will check you out, measure your oxygen, listen to your lungs, and do all of that. Another difference from the spring is we do have medicines, dexamethasone and remdesivir. The medicines that we have now are when you're sick enough to need oxygen. So we don't have anything for you when you're not sick enough to need oxygen. But I don't want people to be too scared to come in. I know we're all scared right now, but if you notice heavy breathing when you move from the living room to the kitchen or the bathroom, that's not normal for you, or if your family member is confused when that's not normal for them, those can be signs your oxygen is low, and we should get you in to see if we can get you started on these treatments early. There's been a lot of question about why can't we get the rapid test anymore. Abbott, everything with COVID is new. The test is new because the virus wasn't here before the spring. Originally, they had said we had 8 hours to run the test from the time we swab. A few weeks ago, they revised that and said we should really run the test within 1 hour of when we swab you. And we are limited to about 6 an hour here, based on our machines. So we are saving those rapid fast tests for our patients in the emergency room who are sick, and we are deciding if they can go home or if they be admitted in Crown Point, or we need to send them out to another hospital. The other thing is we let people come without appointments. We're not having any barriers to getting tested. A lot of times, you get the call that you had a potential exposure, and everybody's first reaction is to go get tested right now. It's better to wait 3 to 7 days after, or at least get tested again at 3 to 7 days. Sometimes people rush right in one day after their exposure, they're negative, and I think some people are getting a false sense of security that they tested negative. Early in the disease, you can test negative and still have the virus and still be potentially spreading it. And I think that's happening in every state across the country and across the world. And that's one reason it's so hard to get a handle on this. People that don't have any symptoms and feel fine can be contagious. So just know that once you get your test, you really, if the EPI team member has contacted you and said you really had a high risk exposure, you really need to stay in as much as possible. So I think the holidays are making it really hard to limit your socializing to your own household. It's been a long year, and this time of the year, we're used to getting together with friends and family. Usually when we get together, we eat, and when we eat, we have to take our mask off. And we have been lucky here in Crown Point that we have been able to get patients out to higher levels of care if they need an ICU bed, or we've been able to find beds for patients. The situation we want to avoid is filling up all the hospital beds in the four corners. And the providers would really like everybody to put a plea out that we have to flatten this curve. We have to stay home if we don't have to go out. Don't take the entire family to Walmart or the grocery store. Don't go visit friends socially. Try and do it virtually, such as this. Wear your mask. maintain your social distance, and we can just do this for a few more months till the vaccine is out and widely distributed. I think we can get through this. So again, thank you for the support from area with all those help for our nursing and our lab and this behavioral health is just for all of our employees. Dealing with the stress of this for a year is a hard burden for everybody. But we have our PPE, we have our oxygen, and now we have staffing. So I think things are really looking up for us here in Crown Point. And I think that's what I have for my report.
Thank you, Dr. Slaughter. Let's move on to then Commander Waito. She's our acting director for our DZ facility. Carrie?
Good evening. I just want to say thank you to the Navajo area leadership and also to Mr. Freeland. I just have a few updates for DZ Health Center. So today we had our highest testing day at DZ. Our 7-day positivity rate is at 16.1. We are grateful to be getting some behavioral health support from Navajo area, and they'll be coming to the health center next week to give support to our staff. So we're really grateful for that. We also are coordinating with Northern Navajo Medical Center to for the vaccination plan, and we'll be working through that. And then we also will be limiting some services at DZ Health Center so we can support Northern Navajo Medical Center with their staffing needs. So starting next week, we'll be reducing to COVID testing, flu vaccination, childhood vaccination, medication refills, and urgent and emergent medical, dental, and optometry services. Any current appointments that are scheduled will not be canceled. And then also we're going to be finalizing a message that we can send to the community. So we are continuing to do the best that we can and work with the resources that we have. And we're so grateful for all the support that we've been given throughout Navajo area and from the Navajo Nation. So that's all I have to report this evening. Please stay safe and thank you.
Thank you, Commander. And then we have one more presenter, Marquise, if you can just give us a quick tribal partnership update.
Good afternoon, this is Marquise. Could you hear me?
Yes.
Okay, perfect. Again, good afternoon. Thank you, Delegate Freeland, for taking the time for coordinating this call, and then to those listening. I appreciate the opportunity to provide an update on our Navajo Area IHS tribal operations COVID activities. My name is Marquise Yazzie with the Office of Indian Self-Determination. I would like to first acknowledge the Navajo Nation, local chapters, as well as the Navajo IHS personnel for their tireless and dedicated work for the Navajo people during the ongoing pandemic. But I do want to ensure you that our COVID-19 response activities remain the area, as well as the Office of Indian Self-Determination's top priority. While we have met this threat head on, any such challenge does provide an opportunity to highlight both our strengths as well as areas needing improvement in our organizations. But as always, the Office of Indian Self-Determination is committed to your success. Earlier today, our office concluded 638 negotiation with the Navajo Nation's 3 contracted programs for the upcoming calendar year 2021. As a result, the Office of Management and Budget from Washington, D.C. has approved an exception apportionment for the full calendar year. And this will ensure that the contracted programs, Health Management Service, Emergency Medical Service, and the Navajo Treatment Center for Children and their families have the resources necessary to remain open during this time. But concerning some transitional water point installations throughout the Navajo Nation, There are a total of 58 complete active water points, and these water points are available for community members for water access needs. Currently, the cost is being incurred by the IHS, but for additional information, individuals may access the www.navajosafewater.org web portal for additional information. With regard to the COVID testing funding allocation, under the Paycheck Protection Program and Healthcare Enhancement Act, or also referred to as Supplemental 4, to combat the COVID-19 pandemic, our office is working with the Navajo Nation OMB, 3 contracted programs, and transferring $5,286,000 to utilize and combat the ongoing pandemic activities into 2021. I do want to note, with regard to the flu vaccine, I do want to continue and remind everyone the importance of the flu vaccine. The flu vaccine is especially important during the COVID-19 pandemic. It does reduce the overall disease burden as well as unnecessary stress on the healthcare system, and it does decrease hospitalizations and reducing influenza diagnostic testing demands at our federal sites as well as our 638 sites. There has been considerable concern by individuals as well as community members of the distinction between influenza and COVID-19. Both are contagious respiratory illnesses, both both are caused by different viruses. The COVID-19 is caused by an infection with a new coronavirus called severe acute respiratory syndrome coronavirus 2, or simply SARS-CoV-2, and the flu, influenza, is caused by an infection with influenza viruses. So the distinction should be made and communicated, but I do encourage individuals to get their flu vaccine. But with regard to reopening, I do want to communicate and echo some prior comments by Ms. O, which is her desire to see the Navajo Area Office return to full operation. However, she does recognize that we do face challenges in doing so. But Navajo Area is currently exploring multiple scenarios we might encounter as we plan for how to resume patient care and operations. But the OISD will continue to remain open and accessible to serve you at the area office. But lastly, I do want to underscore that the IHS recognizes the authority of tribal leadership, both at the Navajo Nation and local chapters that make the judgment calls, which is your right in the exercise of your sovereignty. But as we move forward collectively, our office, or Office of Indian Self-Determination, do want to be attentive and supportive of your needs and your priorities as you make those decisions. But again, thank you for allowing me the opportunity to provide some brief remarks. The Office of Indian Self-Determination appreciates your partnership. Please continue to be safe, continue to take responsible action to help stop the spread of COVID-19. With that, I'll turn it back over to Ms. O. Thank you.
Thank you, Marquise. And again, thank you, Delegate Freeland, for inviting us to join you on this important conversation that we need to have with all of our patients, our community members, our tribal leaders. You have been one of the ones that has been very supportive of us through this whole process, whether it's securing PPE for us or just, visiting our staff to provide words and comments. So I absolutely appreciate your leadership, as well as all of the other Navajo Nation tribal partners that we have had. It's been a tremendous, as you can see by the presentations of our staff, it is a huge endeavor that we are in the midst of. And our goal, of course, is to, number one, provide the best care possible, safe care. We have experienced traumatic loss through this COVID pandemic, and and it's not nearly over yet. So we have to think about moving forward. We have to really think about what is our message moving forward? What are we going? How are we going to? We know we're going to come out of this, but we know it's going to come at a cost. It's already come at a huge cost to our people, to the Navajo Nation, and so we have to look at mental health strategies to try to figure out how we're going to integrate a comprehensive mental health approach. And there's lots of conversations going on about that right now. We definitely need and still want to bring in more tribal leadership, whether it's at the chapter level and throughout the Navajo Nation, to continue to message and remind our people that we have to hang in there. We have to continue to wear our mask. We have to wash our hands, and we have to practice social distancing. And finally, I want to remind everyone that our healthcare system is being stretched to the maximum limit right now. And we have talked about how we could easily go into a very dangerous situation and crisis mode, which we have already had to put out policies in terms of what would we do when we get to that point. So we have those difficult conversations with our staff, our medical providers, which of course are not trained to determine or have to choose which patients they might be able to serve and not serve, which patient might be able to get transferred out and not transferred out. So those are very critical things that we're looking at right now to try to make sure that all of us have to continue to act responsibly. And we have to remind ourselves, I have said several times, this is now on us. Every single one of us has to embrace and take the responsibility, or else it's going to continue to run away with us, as it sort of feels that way from time to time. So I hope that we've given you a demonstration of how much we are working together closely with the Navajo Nation, with the Navajo IHS team. You can hear the fatigue in the voices, and we have lost several Navajo area employees, which is hard. And so at some point, as we're talking about mental health professionals on the ground, we have to be looking at our friends, our families, our mothers, our grandmothers, grandparents, and so forth, our children, to see how they're being impacted, and trying to find ways to make sure that we are providing, all of us providing support to each other. And I also, again, will close with just a shout out to the Navajo area leadership team. Dr. Christensen has been our driver from the beginning, has just been an outstanding partner that has guided us through this process. So has Captain Brian Johnson, Chanel Damon, Dee Hutchinson, Marquise. These are the people that I turn to on almost a daily basis, and where we're constantly in contact. So I want to thank you again. I appreciate your time, and I don't know how you want to address any questions if you have that. Thank you very much.
And thank you to all of the Indian Health Service Navajo area team. You guys are all heroes in my book. And I think when this whole thing started in March, I did reach out to Crown Point Service Unit, and my first concern was PPE, and as well as other areas, but particularly face masks, because nationally there was a shortage. And I was contacted by several universities, as a matter of fact. Kansas State University contacted me, Colorado College, and the University of New Mexico. And we did get some supply shipped to Crown Point Service Unit. So I really am so appreciative of all of you. And like I said, you all are heroes. All the staff at Crown Point Service Unit, all the staff at Zitlan Titli and Shiprock Service Unit, the doctors, the nurses, the pharmacists, the techs, housekeeping, security, dietary, everyone. You guys are all heroes, and we're so thankful for you. We're so thankful for what you have done in stepping up. And And you are correct, Ms. So. There is a lot of fatigue in the voices, and I'm glad that the Commission Corps is going to be helping out the medical team at Crown Point Service Unit and relieving a little bit of staffing, and hopefully it'll give some of the staff some rest over there. So I just wanted to say that and say thank you. Really, I'm so compelled by the way you guys have responded. We were up against a Goliath, and we were almost near the portion where we do see that light with the vaccine. We need to keep our defenses up. We need to keep our guard up. And I think there was a very important point made by Dr. Slaughter. Family gatherings seem to be the common cause of positivity and positivity rates. And I think if we can avoid that, I think that would really help us out as far as bending that curve and getting us down. And here on the nation, but in the states as well as nationally, hopefully we can bend that curve. But it's up to us. It's up to us. And for me, my chapters I have 8 chapters. They're very rural. I've been out there since March. I'm so thankful for my chapters. I have very rural communities as well, but we also have resources out there, untapped resources, and your public health nursing team has been working alongside the CHRs. And another good resources are thankful for our staff is our Navajo Division of Aging and Long-Term Care Support staff as well. The cooks, the drivers, the supervisors have been delivering hot meals to our elders. And I came across one of our drivers just north of Chaco Canyon last week, and I sat there and talked to him for about half an hour. He was done with his route, but we sat in our vehicles respectively. We spoke to each other, and I just thanked him. And it's one of those instances where you have to appreciate everyone's effort, and we're all in this together for sure. So I just want to say thank you again to Navajo Area, the folks at Crown Point Service Unit, and of course up at Zithdali Healthcare Center as well. We're very appreciative and very thankful for your work and you caring for our people. So Ereya Hiansago, thank you very much. I want to go ahead and turn it over to Dr. Jim now. Dr. Jim.
Oh, ja, het is een aantal studenten.
Oh, Abiga, loud and clear.
Yeah, Dysonist Ainan, Dr. Dil Jimin Seattle, Executive Director in the Center. It's East by Hayanje, Big Edens. Don the end Sunday, I look on the Santa Chitney buses team, though. Ashamed of the trade dog was a funny that's another. I don't know, just under icing, I said that what art stands. Quae, and I guess in quae, the caution chagi now states are the Holianishing, Bahasnet Donan. I don't quae, Nifin the Hasnagi is there in the Dunlany dog quae. A chiller stay quae, Miss Rosenso, the Hadzi quae, other quae, not owning. Kadi Honorable Freeland na dahi non Kadi Facebook Live and non Fagi Kadi Bini Nagi I don't ni Kwan is it in it all Kadi hit a streaky is it in a crabas and has anigishe I then had that be no had that street Asian bin Kadi Jodi Clichy the Neshi the caution chagi nast it's other Holiani that's a bedding and the gut that's other cheese but the has anigi that's a he or she been thought though even Kaidi Facebook Live in the quite our creature quite Health Command Operations Center Holiani a quite he in daily study Indian Health Service dog quite Tribal Health Organization Daliani do not only President Nez do the Vice President Lizer do the Aklitin and the hate the Heshit Adi hit the neck the question chagi they go not it's not the hot neto hate other she the information that earlier the is there in the that being been no team for quite it didn't need so Kaiti here dini do non ka in de nishiki e ani ka here non kedini do. Kaiti a health messages haliani day at the behanas that the town hall not le shin. I'm gonna go ahead and share my screen and let me go ahead and provide some information. So Ashi the Nepic at Hanas Chigishin beans go ahead and she behanas also. Kati the question chagi nast it's ata haliani jodi messaging that they nini ita krishnik adintezit kati in hichiton hizet bedada despalo ado ka ajan dake ahun ado o the dada di ni ado nila tanda yes ado Hawan don da nison do hichite biget does such a thing that I think Nisha thought. Although the a lot high guess of any thing that the big it didn't need to that I thought that acquired the 20 seconds not let I didn't know though what I say though Ben they need to say that all yet so hala at the cloud in other quite the color was so hala behind in so excuse so a cuisine art for hala gizon da other hala so da other hala the kai da other art when quite so a project is that the need that so other so tobe behind just auto other quite so dry that has lot in no knowledge a that a paper towel bed that the need. And so I just wanted to reiterate the hand washing. Sometimes it's we are forgetful about the basic hand washing, and I think it's always very important to remember and teach our kids right now too, as parents, grandparents, aunties, or uncles. So always consider ways to teach each other or remind each other to wash your hands as well, to make sure that you wet your hands properly with enough soap. Also rub your hands together between your fingers, around your palm, on top of your hand, on your thumb. So it takes a while to do that as well. And also to rinse your hands properly and dry them completely out too. So and just as a reminder, I always want to emphasize on prevention. So, and if all else you don't have the ability to wash your hand, you can always use a alcohol solution or a wipe that you might have with you. And then if you're awaiting test results right now, I think it's very important that you focus on where to be and how to go about your daily routine when you're waiting for test results. And if you have been tested and you are considering yourself as a close contact, please stay home, especially if you have symptoms of COVID-19. And also, if possible, stay in a separate room or use a separate bathroom. Continue to do all the other precautions, but making sure you're not sharing any personal household items, such as food, dishes, towels, or bedding. And then also constantly cleaning and disinfecting, and a basic, even to the basic level of just using hand soap or bleach or other items can help in disinfecting, washing your hands with soap and water, as I mentioned, and especially monitoring your symptoms and then notifying people that you've been in contact in the last 2 days if you're starting to feel sick. So just as a reminder, if you have symptoms when you're awaiting test results, you really need to stay home and not go to work. And we continue to strongly emphasize that because we want you to stay safe and to reduce the transmission of COVID-19 as well. And if you have symptoms of COVID, if you don't have symptoms of COVID-19, I think you can always stay home and do not go to work as well if you don't have symptoms. And also don't go to school or other places, and also continue to wear a cloth mask even though you don't have any symptoms when you're around others, and even when people visit you at home too, as well as at work. I wear a mask here at work all the time, That's our indoor policy here on the Navajo Nation. Wearing your mask is very recommended here, and also wearing a mask, of course, when you go get groceries or do any errands, and also maintaining your distance is still one way to reduce transmission, because droplets can still travel a distance as well. If you are positive, continue to stay home and separate yourself from others, and drink plenty of fluids as well. Take medicine for pain or fever if needed. If you test negative, continue to stay alert. If you were exposed to a COVID-19 case, you still need to quarantine for 14 days. On the Navajo Nation, we do have isolation and quarantine, and now an alternate care site. We have an isolation and quarantine facility in Gallup and also in Farmington. So residents from either all of those areas can utilize those on the Navajo Nation, especially if you cannot safely quarantine or isolate at home. And this means it's important if you don't have a separate bathroom or restroom, and especially if you are living with other individuals with underlying health conditions. So it's very important that when we talk about generational homes or multi-household or individuals in a household with multiple families, it's very risky at that point. So that's why we encourage individuals to utilize these facilities while we have access to it. And you can call your local health facility for a referral through a CHR, a public health nurse, or a provider, or you can call the Health Command Operations Center line at 928-871-7014 as well. And that number is 928-871-7014. And they can even provide transportation from your home or from the hospital to these isolation areas. And it doesn't matter if you're in Arizona or Utah or New Mexico resident. For those living near Farmington, can utilize these facilities as long as you're Navajo Nation residents or a Navajo living in the border town areas. So just continue to know that when you are awaiting testing results, it's very important to take these recommendations so there's a reduction in transmission of COVID-19. So as well as the COVID-19 incubation timeline up to 14 days. So there are several images across that you can find. So I appreciate this one. So we'll follow Jane. So let's see how Jane's path goes for 10 days. So Jane is invited to a holiday party. So with people she does not live with. So those that are maybe someone you know might have gone to a holiday party. So she has been waiting as well for this event and chooses to go see people she has not seen for almost a year. So all of those holiday party. On day 0, Jane is exposed at the holiday party. So that's a bit so we'll see. On day 3, Jane learns she was exposed and self-isolates at home. So Tujin is now in the party. Jane A. Behosen that the Haitian daughter quite the close contact with any been exposed on so exposed with any kishin for the sometimes you can be exposed if you are around someone with no mask or you were not practicing social distancing. But you might not be exposed if you were social distancing and you never spent a lot of time with somebody that tested positive. So it's been quite exposed on Yaniki. As well, she decides to self-isolate at home, right? And she self-isolate self-isolate that she's in a separate room, right? She's in her own room and she's getting maybe food by paperware and she's cleaning up after herself as she goes into the restroom. If she shares a restroom, on day 4, Jane gets tested for COVID-19. Although Israel inda. She gets tested for COVID-19. Although Haska Israel a Jane test results come back negative. So on day 8, Jane thinks she doesn't have COVID-19 because she tested negative. She goes holiday shopping, visits family members and friends. Jane doesn't know that she does have COVID-19 and is contagious even without symptoms. She has now exposed 10 people. So, Okodi tesigi a negative go nadawat. Ashin hushchit binina dodo zobe husunda. When you do your test, but you are not having any symptoms. Asymptomatic, the symptomatic that the Asian bin the Janie the thousand. So Asian bin kong kinko naga quite big Asian which quite visit in the inkodo the friends that energy, and so there's not quite individual she visited 10 people. So day 10, Jane develops symptoms and she gets tested again and tests positive for COVID-19. So Adena is not as late, so Jane tests positive. Of course, she ain't quite the question chagi non-states are not. So just to know there's a time frame that testing does make a difference. So even though if you tested negative back in February or March or June, you don't think that you can't get it because you got tested a long time ago. That's all. Yeah, it's really dependent on your level of exposure. So even on the spells and they'll continue to quarantine the full 14 days. Is linked to quite 14 days that the August 8 days is linked to I thought Jane how does she know not about that. So that's really the message that we want to do is there is a 14-day incubation period. Make sure you stay at home. So because that 20 that's also I just want to talk about Jane's experience. Also, on a lockdown, it should be not at the 3-weekend lockdown that the no do akuite to asa kingona wa that the ne ado kuishi it's chin besto on himasandon hiche the arts for kingona kigo that the ne to and ado yan bin yeda asa ako so zongo kon kingona na ke that's na kwashi that's all yeah. So one person at a time to do your shopping to reduce the transmission of COVID-19 as well. Although the definition is not quite the Navajo Nation, but that's a photo Haitian that's IHS bandash ultra that's a chapter house that energy. We receive reports from the Department of Health and the Health Command Operations Center of Thought. They go up and now I has go not that the ne quality is on definition the has not thought a thought on the sendo hot up on sita case so quality as one the quite hit the hundreds go what then die so the neto quality. Monitor your health at the neto balance and that quality the close contact you might not know or you might not know because quality ban hit the net asymptomatic the do but hanes get done the quality the question target not eight other but the whole lot they can infect quality they're infectious as well. So so monitor your health and wear your mask and at work as well. Practice social distancing and shared spaces. Avoid sharing objects and equipment too. In your workplace, you might be wearing or sharing, intercom or either telecom or computers or certain things. every couple of hours in here could the hinanish idea hos unge we will try to wipe down things every 2 hours. We have bleached water solutions, and we make sure we make that accessible, and it's a routine for everyone now. So maybe you can ask your boss tomorrow, or if you are the boss, to see how you can put a routine cleaning schedule into your workplace. Bring those up. It's very important. And then keeping a hand sanitizer is important also, and then avoiding having visitors. Everyone is supposed to be in shelter in place right now, but be mindful that things could happen through a phone call or other ways too. So that would be one recommendation. Although Navajo Nation or please report exposures for any place of business. It's on the Navajo Department of Health webpage. There's a button that says report exposure. So click on that button to report a potential exposure. It doesn't ask for a lot of information because a case manager is going to follow up with you to confirm if it is a true exposure or not. But for the Navajo Nation employees, we need those data reported so we can schedule a cleaning for you. So with that, anything we have a workplace policy for the Navajo Nation, and so go to the Navajo Nation reopening plan, and there's some guidelines. Although businesses, they're supposed to have all of these safety guidelines, part of the Navajo reopening plan. All businesses are supposed to have procedures and policies in place to address a lot of the things that I'm talking about this evening. Although free drive-through testing, they've now under the Health Command Operations Center, they have the free testing and availability, but for Crown Point, we're there every Thursday. So make your way to the chapter house to Crown Point chapter or Shiprock chapter, and there is a form you fill out. You stay in your vehicle. If individuals test positive, you'll be notified in 2 to 3 days, and your results will be shared with the local health facility for contact tracing. And please answer your phone calls, because results will not be left on your voicemail or text. And there's a coordination center that you can call and to get your results. And also be available to answer your calls as well. They don't pick up their phone, and it makes it more challenging as well. Although the safest place is at home, that's why we have a shelter in place with the public health order. It's only for emergencies. Tiando is in the to go get gas, but right now it's not a time to visit family, and we're recommending avoiding gathering, especially among multiple households. So find ways to meet with your family virtually or by phone, but we encourage everyone to stay safe at home. And if you or someone you know needs resources and has tested positive, you can always call the Health Command Operations Center line at 928-871-7014. So I want to thank all the listeners that are on the call this evening, and I just want to close with that, Honorable Freeland. So if you had none, for allowing me to provide some information, and have a good evening.
Thank you, Dr. Jim Hiansago as well. Thank you for all the work that you and your team have been doing. You all have been working since March as well, so we're very thankful, very appreciative as well. I just want to say thank you. This was a mechanism tonight to share important information with all of our people, especially out in the Crown Point area. and the chapters that I represent, but most importantly, Eastern Navajo Agency. Excuse me. But I wanted just to bring some resources to our area and what can we do as individuals and as Navajo people to, stop or help bend that curve. What do we need to do? So I guess my question to all of you tonight is, with one message, each of you, what would that message be to our people tonight? If you want to say one thing to them, what would that be? Dr. Jim, I'll start with you, then Rosalind, you can go with your team.
Well, my message would be to stay home and stay safe, just to protect our elders and our neighbors and everyone else. And so that would be my message. Thank you.
Thank you. Rosalind?
Thank you, Delegate Freeland. My message would be, we have to all stop at this point and think about our parents, our children, all of those individuals that could be impacted by our carelessness. And so, if a parent doesn't make a good decision and something happens to them, a child could be left behind. And so we have to think about what we're doing in every step that we take from here on out. So it is about the public health orders, but this is not going to stop unless we take this as real personal and think about those individuals that maybe have already left us as a result of COVID. Thank you. Captain Johnson, are you on the line?
Yes, I'm here. I think my message would be somewhat similar to Ms. So's in that really stop and think about the individuals on the front line providing the care and the situation that they find themselves in. Not only are they working hard every day and have not only concerns in their work environment, but also when they go home at night. And we all have something to contribute to avoiding that any further. So again, staying home, thinking of others, and just being kind to one another.
Dr. Christensen?
My message is the best way to show love for each other and your family is to protect them. And that is by staying home, wearing your mask, watching your distance, and washing your hands. That is the only way we can stop COVID and keep our family safe. Thank you.
Pam?
Hi, my message to everyone would be the 3 W's: wear your mask, wash your hands, watch your distance, and also staying home. We can't overemphasize that as healthcare workers. Can you hear me?
Yes.
Okay, thank you.
Thank you, Pam. Dr. Slaughter?
I had two things I wanted to say. I really like the diagram that Dr. Jim used, which sort of explained the dynamics of when you get tested and that you can still be contagious. And this, what Captain Johnson said, being kind. I am saying that every day to my staff. All of us are stressed, and we have many good reasons to be stressed. And we can all just take a deep breath and remember to be kind to one another. It will help us get through this safer and sooner.
Thank you, Dr. Slaughter. Commander Waito?
My message would be, Shona, let's work together to stay safe and stay home so we can get through this virus and be able to spend time with our families again in the future. Thank you.
Thank you, Delegate Slater. Oh, excuse me, I'm sorry, Delegate Freeland. That concludes our comments.
Thank you. I'm I'm not nearly as good looking as Delegate Slater. Just kidding. Office of the Speaker, is there anything you wanted to share as a message?
Hi, good evening. This is Melinda. Thank you, Hiha, for giving us a few minutes here. It is myself and Mr. Byron Shorty that's on the line this evening. So we really appreciate being invited on this call to continue to receive updates. On behalf of the Office of the Speaker, we just want to say thank you very much, Hiha in Chicago, for our area IHS director and staff, as well as other representatives that have came on to give updates. Dr. Jill Jim, here in Chicago, jono a presentation in lado benachashia bonsade case do nasko hot a bendel nito. So thank you. We just wanted to express our gratitude, and then I'm not sure if Byron has anything he wants to add. Thank you, Delegate Freeland.
Thank you. Appreciate that. Office of the Speaker staff. I just wanted to thank everyone this evening. This was our first town
Mark,
hall this
Delegate
evening.
Freeland,
Yeah,
this is Sherilyn Ghazi. I'm sorry.
go right ahead, Sherilyn. Did you want to say something?
Thank you. Oh, Shehet Shanaim, Delegate Honorable Mark Freeland, Nana, other delegates on the line, Deja Tilla at the office, Nana Shade Rosin So, with your team of experts from India, Navajo Area Indian Health Services. On behalf of the Office of the Speaker and Speaker Damon, thank you for all your hard work and everything that you do. There are no words that I can conclude to share the abundance of gratitude on behalf of the work that you guys continuously do on behalf of the Navajo Nation and our people. And I just hope and pray that each of you are blessed 10 times more with good health and prosperity. In addition to that, to our Navajo people and to our Navajo leaders, thank you, Shania Mark, for doing this and reaching out to our community. Just ask each and every one of you, those of you who are listening, na oshkan kitishno yeste the kosen schagin and khayni yahagi, please wear your mask, stay safe, make responsible decisions, and ensure that you sanitize on a regular basis. But more importantly, stay home and protect your loved ones. Have a schedule on who will go, who will come home, who will sanitize. Please, I urge each and every one of you that information and that happy holidays. Have a beautiful Christmas sitting around the fireplace and telling stories, winter stories. So that's what I would like to share on behalf of the Office of the Speaker. Back to you, Brother Mark.
Thank you. Deja, thank you. Thank you for joining us this evening. I just wanted to say thank you again one more time. My message is it's up to us. I think it's up to us as individuals. We all have a responsibility. And I think if we follow and play by the rules and stay home and protect ourselves, I think we can do it. We can do it. And I know that I talk a lot, especially to my chapter officials, about individual responsibility. It's about the choices that we make when we go out and protection. We protect ourselves in order to protect others. So we have to keep that in mind. I wanna encourage all of our people to remain diligent, remain resilient. Please practice your mitigation. Please protect yourselves, but more importantly, protect others. Elders are our most vulnerable population. Elders, we have to protect those populations, and I think it's up to us how we're gonna do that. So I just want to say thank you to our presenters tonight, our panelists, the IHS Navajo Area IHS Indian Health Service team, as well as Dr. Jim. This call or this Zoom teleconference was really an indication as to what's been going on in our area, particularly because, you know, we are facing a high rate of cases, of positive cases in the Crown Point area. 77 new communities have been listed, and we're one of them. So I just want to say thank you to our team. Thank you to all those who shared tonight. Maybe we could, anyone want to say any parting words before we conclude? If not, I just want to say God bless you. Happy holidays. Take care, and we'll see you soon. Hagonet.
Thank you.